This lesson is on pediatric eye, ear, nose, and throat conditions. In this lesson, we will cover common eye, ear, nose, and throat conditions experienced by children. Let's start with the eye, and let's talk about conjunctivitis. Conjunctivitis is defined as inflammation of the mucous membrane that covers the front of the eye and lines the inside of the eyelids. It can be caused by infectious organisms, allergies, or trauma to the eye. Infectious conjunctivitis is very contagious. The vast majority of conjunctival infections in children are caused by viruses. These are usually the same viruses which cause upper respiratory infections, including adenovirus and rhinovirus. Viral conjunctivitis is self-limiting and no treatment is required. Bacterial conjunctivitis is caused by common bacterial organisms such as Staphylococcus, Haemophilus, and Streptococcus. There are effective topical antibiotic treatments for these infections. Bacterial versus viral conjunctivitis can be differentiated if a culture is obtained of the eye discharge. If unable to obtain a culture, the distinguishing characteristics include that viral usually causes watery discharge versus a mucopurulent one for bacteria, is usually unilateral as opposed to bilateral for bacterial, and is usually associated with pharyngitis as opposed to bacterial, which is usually associated with otitis media. Home care education includes frequent clearing of the discharge by wiping and frequent hand washing. The child should also be reminded to keep from rubbing and touching their eyes if possible. The course of conjunctivitis is usually complete within 5 to 7 days of the infection beginning. Another eye problem that is common in childhood is strabismus. Strabismus is when the eyes are not properly aligned. Amblyopia occurs when vision is reduced due to strabismus. Strabismus does not always lead to amblyopia, but amblyopia is almost always preceded by strabismus. For the first several months of life, occasional eye crossing may be normal as the eye muscles become stronger. After 3 to 4 months of age, this problem should correct on its own. After that age, babies should be evaluated to determine if the eyes are properly aligned. A condition called pseudostrabismus occurs when the eyes appear to be misaligned, but in actuality are normally situated. This optical illusion is due to the fact that the medial skin folds between the eyes on the sides of the nose are not always symmetrical. This may give one eye the appearance of turning in. The way to distinguish this from true strabismus is to check the pupillary light reflex. With pseudostrabismus, the light reflex will appear to be symmetrical between the two eyes. This recognition may prevent unnecessary referrals to ophthalmology and allay parental anxiety. For cases in which there truly is strabismus, the pupillary light reflex will be asymmetrical. Early referral and treatment is essential in preserving vision as much as possible. If only one eye is involved, patching of the good eye may cause the weaker eye to strengthen. This may help the child to avoid having to have surgery. In more severe cases, surgical correction is required to preserve as much vision as possible. The incidence of true strabismus is higher in babies who have been born prematurely. Therefore, a higher index of suspicion is required for babies in this category. Since infants are not able to complain of symptoms such as decreased vision, diplopia, photophobia, or headaches, increased awareness of the appearance of the eyes and any notice of lack of proper developmental milestones being reached may be the only clues to the development of strabismus.